A pleasant day to you. I am Magna Maris Macabenta, and I will be having a health teaching presentation that is aligned with my future profession, which is nursing. Today, I will be presenting a not so common reproductive health problem that most women suffers today, and it is called polycystic ovarian syndrome. This disorder is overlooked by others, and it needs more attention as well as awareness and support from other people in the society. Let me ask you first a question. Have you ever encountered people who are obese, has a lot of acne, suffers from alopecia or thinning of hair, has dark bikinis and underarms, as well as irregular menstruation? And have you ever judged them as a person who don't have personal hygiene as well as controlling eating? Maybe some of you have. The things that I have mentioned are just some of the symptoms or infestation of a person who suffers from polycystic ovarian syndrome. Before I dive into the main context of this presentation, let us first understand the nature of this reproductive disorder. So PCOS or polycystic ovarian syndrome is a hormonal disorder that is common in women who are 15 years old or in a menstrual stage and above. It is characterized by hormonal imbalance where male hormones such as androgen are elevated. This disorder may lead to infertility in women as well as different health complications. Have you ever wondered what a normal ovary looked like versus ovary with multiple cysts? So here I have two balloons. The first one, which is a purple one, represents a healthy ovary. On the other hand, the pink balloon represents polycystic ovary. As you can notice, there isn't much difference on the outer appearance of both balloons. The polycystic ovary contains more follicles that appears as small bubble cysts in ultrasound. So here's the catch. When I press this pink balloon, you can see that there are small circles that appears, and that's what an ovary with polycystic looks like. PCOS has a huge impact on women's quality of life. Imagine how a woman with this condition suffer. Aside from the symptoms that they have experienced, they also experiences discrimination and bullying. Some of them are bullied because of their weight, shape, acne, as well as mood swings. But few people know that PCOS causes acne, that PCOS causes bloating and weight gain, that PCOS triggers depression, stress, and in some ways, anxiety. How scary it is for a woman to fight this battle alone without the help and support as well as understanding of people around her. Just like other reproductive disorder and illnesses, PCOS is full of stigma that no one talks about. Most women are forced to accept the discrimination that they receive. This is because no one dares to speak with them. It is time to educate people, men or women, young or old. Just like how we stand to fight the discrimination against people who suffers from HIV and AIDS, we must also fight the stigma on people who suffer PCOS. All women are strong and pretty, but PCOS makes them feel less. With the knowledge, support, and power from others, let us fight PCOS and stop the stigma. As a future nurse and an advocate of health, I must say, together we stand. Women, let's fight. Thank you and have a good day.